Welcome to our talk about managing your fatigue. This talk is part of our health and wellbeing education series for people affected by cancer. It is based on research and includes advice to support you before, during, and after your treatment. The other videos in this series are about being active, healthy eating, improving your sleep, and managing the emotional impact of cancer. You may choose to watch them separately or together, as the advice in one video can help you to manage some of the concerns raised in the other videos. For example, having more energy can help you to be more active. If this talk raises any issues or questions you'd like to discuss further, you can join our Manage Your Fatigue workshop. Details of this are at the end of this talk. 9 out of 10 people with cancer will get fatigue at some point. It's not the same as tiredness. Tiredness is a normal feeling that most people get at the end of the day or after physical activity. Fatigue can have a significant impact on your daily living. It can affect your physical ability to do things that you once found easy to do, and it can also affect your concentration, focus, and memory. You may have difficulty concentrating on a TV program or have to reread a page in a book. You might find that you lose or misplace things more frequently. Fatigue can also affect your emotional well-being. You may feel tearful more often or find that people irritate you by doing things that didn't bother you before. Any emotion you experience may be affected by fatigue. Fatigue can also have a social impact. You may find that you don't make plans to meet friends as often as you did before, in case you aren't feeling up to it on the day. It can have a financial impact. A Macmillan survey found that 4 out of 5 people with cancer are financially worse off. You may be unable to return to work or have other additional costs. Fatigue is different to tiredness. It's important that your family and friends understand this so they can support you well. You may find you have less energy to do things or struggle to finish tasks you could easily do before. You may spend longer in bed or feel more tearful or depressed. You may have a fuzzy head, find it difficult to concentrate or make decisions, or be more forgetful. You may have difficulty breathing after a short walk. Your limbs may feel weak or heavy. You may have other symptoms too. Fatigue can affect people in different ways and at different times. It's normal to feel fatigue during treatment, and this can continue for a while after your treatment finishes. For most, their energy will return to normal within 6 to 12 months of finishing treatment. Less commonly, people may have fatigue for longer than that. There are many causes of cancer-related fatigue, including the cancer itself. After cancer treatment, your body works hard to repair itself, which can cause fatigue. Cancer treatments can cause nausea, vomiting, mouth sores, and diarrhea. If you experience any of these side effects, your energy may be affected because your body isn't getting the nutrition food normally gives it. Pain can also cause fatigue because you use a lot of energy to deal with it. Also, you may be less able to rest or sleep if you're in pain. Feeling any emotion intensely can cause fatigue. A bad night's sleep can affect your energy the following day. Being less active can lead to fatigue because it causes your body to become deconditioned. Certain medicines can make you drowsy or affect your sleep. If you feel that your medicine is causing fatigue, tell your hospital doctor or nurse. You may have another health condition which could cause fatigue, like diabetes or heart disease. There are 5 things that you can do to improve your energy. Be active, eat a healthy diet, sleep well, rest, and relax. We now know that being physically active during and after cancer treatment can aid your recovery and improve energy levels. You can get more advice about this in our educational video called Be Active. Eating a healthy diet is one of the best choices you can make for your overall health. It can help you have more strength and energy. It can also help to reduce the risk of other types of health problems. You can get more advice about this in our educational video called Healthy Eating. Even though your fatigue might make you feel like sleeping during the day, try to keep to a normal sleeping routine and get good quality sleep at night. Sleeping well can improve your energy. You can get more advice about this in our educational video called Improve Your Sleep. Resting gives your body time to recharge your energy. Resting is more helpful before you get extreme fatigue rather than afterwards. You can stay awake to rest. Just stop what you're doing and sit or lie down for a while. You can take short naps during the day if you need to. But remember that napping may affect your sleep at night, so try to keep naps to 30 minutes or less. Taking time to relax is also important. It gives your mind time to switch off and be free from stress or anxiety. You could try a relaxation technique or things to distract yourself, like doing a puzzle or reading a book. To avoid extra stress, set goals that you know you can manage. Because if you try to do too much, you may feel frustrated that you're unable to do everything you plan to do. Even if you follow the advice in our videos, your energy may still not be as it was before. So now we will look at what you can do to manage your energy more effectively. It's common for people with low energy to follow a pattern called the boom and bust cycle. Understanding how it works and looking at ways to overcome the cycle can help you to make the most of the energy you have. On a good day, when you have lots of energy, you may overdo things. The following day you may have more fatigue and you need to rest more or do less. When your energy improves, you start to do more again. If you follow the boom and bust cycle, over time you're likely to have more fatigue than if you paced your activity. You may spend more time resting, making it harder when you try to be active. You may decide not to make plans in case you need to cancel them if you're fatigued. This may lead you to feeling frustrated and thinking you've failed. How can you stop the boom and bust cycle? You can overcome this cycle by following 4 rules called the 4 Ps. These are prioritize, plan, pace, and permission. It can help to prioritize your tasks and activities by writing them down, so that you use your energy for things that you need to do and don't waste it on tasks that don't need doing. You can learn to prioritize tasks and activities by writing down tasks and activities for the week, including things you must do and things you enjoy doing. Working out what needs to be prioritized. Thinking about how much energy each task needs. Asking others to do tasks for you. You can then plan your week so that you focus on your priorities, don't waste time on things that don't matter, and don't overdo things. In your planner, firstly, write down tasks and activities that are priorities. Don't do more than 2 or 3 high-energy activities each day. Schedule in periods of rest before activities that use a high amount of energy. Schedule in activities that you enjoy doing. If you work at a slower pace, it's likely that your energy will last longer. Before you start a task or activity, think if you can work at a moderate pace, stop before you get fatigued, break tasks into smaller ones. Use equipment to help with tasks, like a vegetable chopper, a slow cooker, or a tumble dryer. Sit rather than stand for tasks where possible. Give yourself permission to stop and rest. Ask others for help. Be kind to yourself. It can be difficult to know how to make changes to manage your fatigue. If you've learned something from this talk that you think may help, start by doing that. It's better to make small changes over time rather than all at once. If you need extra support, join our Manage Your Fatigue workshop. Details of where you can get more information about the workshop are at the end of this talk. Further support is available if you need it. Call our helpline on 020 3447 3816 to speak to a support and information specialist. Join our Manage Your Fatigue workshop. For upcoming dates, call our helpline or visit our website uclh.nhs.uk/MSIS. Ask your doctor or nurse to refer you to an occupational therapist. Read the Macmillan Coping with Fatigue booklet. Download the Untire app, which is recommended by the NHS. Visit Restore, which is a new online tool to manage fatigue. You can also ask friends and family to support you.